I am Dr. Pavitran, Professor of Medical Oncology at Amrita Institute of Medical Sciences, Kochi. Amrita Institute of Medical Sciences is a 1,300 bed facility having about 57 specialties, and oncology is one of them with a comprehensive cancer center, and includes medical, radiation, surgical, pain and palliative specialties. And the importance of this is we have all the facilities under one roof, and advanced radiation facilities like cyberknife, then advanced chemotherapy facilities like bone marrow transplantation, and surgical facilities like robotic surgery. All these are available, and also all the special investigations like PET scan, and including MRI PET CT scan and MRI PET scan. All these are available under one roof. That is the main advantage of this hospital. And we see about 5,000 new cases in a year, cancer cases. And the oncology facility at Ulumali Hospital was started in 2017, and we were providing the service from that time, and it was slowed down because of the COVID, but again we have restarted that facility, and we were able to train the nurses there and also the doctors to manage the common complications and the chemotherapy that is being administered there. So, and we are also supervising and going, and also online we are monitoring all these activities, and the facilities or the treatment that we are giving here is at par with the facilities there also. And initial workup we are doing here, and after starting the treatment, they are going and continuing. Most of the patients are continuing there because of the home environment. And complicated treatment is given here. Usual chemotherapies, that is routine chemotherapies, are given, and there we have a 4-bed facility for administering chemotherapy. Maldivian patients, generally they are well known about the disease, and they are updated, and they read and come with the recent knowledge also, and they'll ask a lot of questions, and also the full treatment plan, including the most recent advances in treatment. So we are able to cater them, including the latest treatment like immunotherapy and targeted therapy also, as this is covered under the Asanda insurance, and most of the patients are getting the most recent treatment that is available anywhere in the world. The common cancers that we see in Maldives is mainly in women. It is breast cancer, then thyroid cancer and ovarian cancer, and that is a pattern that we see here also. And in males, the common cancers are lung and prostate and hair and neck cancers, mainly oral cavity. So the main reason for this increasing or increased incidence that is seen are mainly because of the lifestyle changes. In females, the breast cancer is common, and it is related to the lifestyle, like obesity. Obesity is seen about more than 60% of the people in Maldives, and this is said to be one of the reasons. Other than that, the reasons are not very clear. And also smoking is also common, like in India, smoking is also common, and that is one of the reasons for the increasing incidence of lung cancer and oral cavity cancer. In cancer, some of the treatments are like will have very dramatic effects. For example, one patient who came from Maldives in a wheelchair because of multiple myeloma, because of severe pain. He was having severe pain, and he was bedridden for about more than 1 month. So when he came here, we worked up and we found to have multiple myeloma. And after starting treatment, within 1 week, his pain got controlled, and in about 2 weeks' time, he was able to move around with support, and he went home walking. So some of the treatment effects are that much dramatic, and some of the treatments, or even though we cannot cure many of the cancers, but most of them we can control, and especially if found in early stage, we can treat and cure them also. So the diagnosis of cancer is not the end of the life, and we can give them hope, or even we can give them cure in at least in majority of the cases.